Darcy for your health massage, and I'm here today with Tori, and we're going to do a little bit of a cupping demo. And I just wanted to answer some of the questions about cupping as well as show the process of having cupping done. So, Tori has been kind enough to be our model this morning. Hi, Tori. And I'm going to start by putting a couple cups on. And when we place the cups, you feel a little bit of a pull as the tissue kind of sucks up into the cup. The latch takes about 2 minutes. And after the latch, the cups tend to get a lot more comfortable. So you might see a little bit of a squirm as the cups hit the tissue here. But as Tori will be able to tell you, the cupping is magnificent and the discomfort goes right away and just kind of melts the tissue down. The fire is just to burn the oxygen out of the glass and make the cups stick. The cupping isn't really hot, and we have one that's not stuck super well right there, I can tell. The patient doesn't really feel a little bit of generalized warmth, but you're really not going to feel much heat from the cupping. There we go. That's a better stick. So, cupping is about, it was 1500 BC or something to that effect. Very old treatment. It's been around forever. It's incredibly effective. It's completely and totally harmless. A lot of times people see the coloring coming up in the cup and the bruised appearance after having cupping, and they're worried that that has caused some sort of damage. And the truth of the matter is the cupping pulls up stagnant blood, lymph, debris, basically waste out of the tissue. And so the color that you see coming up is actually coming from down deep. It's coming up more superficially. It's going to be carried out of the body through the lymphatic system. So this isn't a fresh bruise. By contrast, if we were to punch Tori, we would cause bruising, we would cause damage. This is rather pulling out old damage from the tissue and bringing it up to the surface. So the bruising isn't something to be concerned about, and it's technically not even really bruising. So the cupping, you'll feel the latch. After a couple of minutes, you'll start to feel the tissue dissipate. Cupping means to reduce infection and stagnation, and that is the Eastern medicine approach. My approach for cupping is I'm doing myofascial release with it. So I'm preparing the tissue for probably some fibrotic tissue massage, or the scraping of the tissue, or some deep tissue work, or another modality. I usually don't use cupping alone, although if someone were looking for a deep tissue massage, 5 minutes of cupping equates to about 90 minutes worth of deep tissue. As you can see in these jars, the tissue sucks way up into the jar. And we get about 4 inches of tissue depth release. So we're going down as far as she has muscle tissue and releasing that. Cupping, actually, I've even done for asthmatics, because we're getting so deep in there, we can release and give a little bit nicer breath for them, a little bit more comfort. Most of the sessions I do involve cupping. It's appropriate for semi-fresh injuries all the way to old injuries. It does a ton of myofascial release in a very short period of time. It's somewhat comfortable. It depends on how it's being done.
I think it feels good.
You think it feels good? That's awesome.
Yeah.
So usually I let the cups latch for a minute or two, and then I'm going to take them through and do a bit of a massage with them.
Yeah. You can keep doing that.
The fascial tissue is not like muscle tissue. It's not in nice straight lines. Fascial tissue is more of a matrix. So where these pull the most is actually where you have more tissue damage or more tissue restriction. My entire treatment premise is based on function. I treat 90% athletes, and the treatments are not about coming in here and being comfortable and relaxing. The treatment's about restoring your full range of motion, your full function, and your full recruitment of muscle fibers. So there's a lot of squirming on this table, but there's also a lot of restoration that happens here. So a normal session would be start usually with some cupping, and we're just trying to loosen everything up as quick as we can so we can get in there and deal with whatever, if it's an injury or simply a stagnation, maybe you have a lack of range of motion, really common that's inhibiting your performance. And the cupping's going to help us just loosen everything up so we can kind of get you back to square one. After cupping is done, the amount of marking you have depends on just a plethora of variabilities. There will be anything from just this nice little red pattern that is essentially healthy tissue. We're just moving blood through it. This type of thing is going to go away hours to within a day. If we're treating an injury like you had an old shoulder dislocation, or you had a long history and you get a dark purple cut mark over the joint, that's going to take longer. Those tend to get lighter and lighter with subsequent treatments as we pull that stagnant tissue out of there, but it wouldn't be uncommon for someone to see marks for 1 to 2 weeks after a treatment session. And again, it's not fresh injury, it's not even technically bruising. It's something that is just going to go away. So this is cupping. This is what it looks like. Been around for thousands of years, completely and totally harmless. Makes a ton of headway in a very short period of time. Mostly tolerable, comfortable.
Mm-hmm.
And it just gets a lot done in a quick period of time.